This is a COVID virus, and this is the flu. The two have some similarities. Both are respiratory diseases, both mutate regularly, and both have vaccines that can prevent serious illness. And the framework for updating the COVID vaccine might look similar to the one used for the flu vaccine in the future.
We likely are moving towards a path with a vaccination cadence similar to that of the annual influenza vaccine.
But there are some key differences between the viruses and the vaccines that experts say makes applying the same framework challenging. And those challenges have created a debate on whether vaccinating COVID like we vaccinate the flu is actually the best way to tackle the virus. Here's how the uptake process for the flu vaccine works. The flu is the only vaccine that the CDC recommends be taken annually across the public.
Even if you've been naturally infected or vaccinated the year before, you may well not be protected against serious illness from the new strains that then come into the country. So that's why we need a yearly flu vaccine.
Dr. Paul Offit is a member of the FDA committee that advises the administration on which vaccines to approve and to authorize for emergency use.
Influenza is a single-stranded RNA virus. When single-stranded RNA viruses reproduce themselves, they're not terribly faithful. For that reason, then, as that genome is reproduced and reproduced and reproduced, there are errors that can be incorporated.
Annual flu vaccines are typically trivalent or quadrivalent, meaning they cover 3 or 4 different strains of the virus that can be circulating at one time. Global health organizations and researchers work together twice a year to decide which strain should be included in the vaccine. Since the northern and southern hemispheres have different flu seasons, they look at which strains are already circulating in other countries to predict which ones might make their way to the other side of the globe. Updated flu vaccines don't typically go through human trials for efficacy or safety before they are distributed to the public. Instead, they rely on tests on human samples like mucus and blood, animal testing, and extensive experience with the disease and vaccines.
We have now decades worth of correlations between if we give this vaccine and it induces a certain immune response in mice or ferrets, that we can take a pretty good guess as to whether or not it's going to be effective based on what's circulating.
And there are similarities between that process and the process for the new bivalent COVID vaccines, which were authorized by the FDA in August.
These new vaccines were cleared for use without being tested in humans or having the results from the human testing. Also, they target more than one strain.
But there are also some differences, because COVID is less predictable than the flu. Flu season typically runs from October to March in the US. That's when activity peaks. But while COVID has had the strongest surges in winter, there isn't a predictable pattern yet for when the spikes will start or when a new variant might appear. Flu vaccines have also been produced for a long time and use a standardized process to target the same strains. COVID vaccines don't have the same coordination mapped out yet.
With COVID, we've got lots of companies working on different technologies of vaccines, and they are testing their vaccines with different strains. It's sort of just a little murky or a little messy there as to what the industry's doing.
The unpredictability of the virus has made it tricky to know when the right time to boost is. An FDA spokesperson said they don't know yet if individuals will need to receive additional booster doses of the COVID-19 vaccine, but it may be possible the annual ones will be needed.
There's a lot of variables that are sort of unknown right now. One is that how long the protection from these vaccines will last is one thing that's still being studied.
With the original COVID vaccines, some studies show that neutralizing antibodies, which help prevent viruses from infecting cells, may start to wane after 6 months, or even sooner with newer variants. But vaccines also induce T cells, which attack cells infected by the virus when antibodies fail. Some studies show that these cells might offer longer protection even after antibodies wane. Some experts think annual shots are the best way to balance timing. Others aren't convinced yet.
There are doctors out there who say, hold on, maybe we need to do it more frequently. Maybe we need to have a new vaccine every time we see a sort of a worrisome variant. We have some who are saying one booster shot will last you for several years. Maybe just the first booster will be enough for some people.
Some, like Dr. Offit, also say that while it's not clear if the entire population would benefit from updated boosters, there's a clear benefit to some.
This booster dosing, frankly, for those who are at highest risk, is clearly valuable. The elderly, people who are immune compromised, people who have long-term heart or lung, kidney, or neurological disease. So I don't think there's a downside to taking it. I just don't think the upside is quite what it's made out to be.
Offit was in a minority that voted against including an Omicron component to updated boosters in June. He says he would have liked to see more data on the vaccine and how it was administered.
I didn't think data were presented that were convincing that the bivalent vaccine was any better than the current vaccine.
But other experts say that updated boosters will be a useful tool in fighting the virus moving forward.
Modeling projections show that an uptake of updated COVID-19 vaccine doses similar to an annual flu vaccine coverage early this fall could prevent as many as 100,000 hospitalizations, 9,000 deaths, and save billions of dollars in direct medical cost.
Medical experts will be watching the rollout of the new bivalent vaccines closely to make decisions about the future vaccination process.
Researchers will test these new bivalent vaccines against these new variants, and they'll see how well they work, if they work, and that will sort of set the course for changing vaccines in the future.
The White House said that we are moving toward a point where an annual shot should provide a large majority of Americans protection all year, barring any major changes in the virus that would warrant an update sooner.